we're going to speak about PDT for non-malignant diseases. And as I was telling you, this is a very important application of PDT. You see, PDT is a nice and modern treatment of cancer, but still has a lot of problem. And we have to say that. You know, it's a very powerful technique. The principle is very simple, right? But nevertheless, we still did not reach the success we would like to, because we still need more and more development. I mean, we have to find in different ways, we have to find the right chemicals for the right applications. And that's why this is going on, you know, all around the world. And the hope is that eventually it will become a first choice for many cases. But up to now, we still have limitations. But one thing is sure, PDT works and works reasonably well for the way we're doing. If we can somehow improve the way we're doing, it's going to work even better. And then, in that case, I'm sure will be a choice. But still, a lot of clinical research that has to go on. Right? But there are another situation where PDT is making a very big difference. And last year, we went to the largest meeting in the world about photodynamic therapy in Germany. I was there, Claudio was there. And one of the most impact results were concerning biological control, how they are using photodynamic therapy to control localized disease, localized infections. Okay. So this is powerful and is much easier to do than to do PDT for cancer. So that's something that we have to pay attention to. And I'm presenting this together with the chairwoman. So now if we look at the principles of photodynamic therapy, you know, there is a big difference between phototherapy, photochemotherapy, and photodynamic therapy. And normally, the principle is that we need light, we need a drug, and this by itself is already doing some effect. But if you have oxygen together, then you have light, drug, and oxygen. This is what we call the photodynamic effect. At least that's what people are calling around the world. I'm not saying that light and drug alone doesn't have any effect. It does. But we all know from experience that the oxygen is an important part of the mechanism. So people are adopting the photodynamic therapy as light plus drug plus oxygen. And of course, everybody knows there is another mechanism that are the formation of other free radicals that also participate, but they are not the dominant effect. Now, if you look to this, you see, there is nothing to do with cells in here. The cell is just the substrate. If I have this inside a cell, I generate cytotoxicity, and I kill the cell. But the principle doesn't need the substrate. It works even in solution, without cells. Then you can imagine, well, why cell? Why not bacteria? Why not virus? Why not fungus? Fungi, how you say that? Fungal infections. So this is the idea. You know, the principle is more than killing the cell. You can destroy anything if you produce reactive species. So people are seeing this as a possibility of killing, you know, microorganisms, bacteria and other ones. So this is what I'm going to show you. is how PDT is being used for other application rather than cancer. Even though we believe that cancer is the hardcore problem and it demands a lot of efforts. But sometimes the other ones are also serious. And there is one situation that PDT is being used with much more success than cancer. And that is the macular degeneration. In the eyes, sometimes there are diseases, sometimes relate to age, when you're getting old. And there is a degeneration of the sensitive part of the back of the eye. And that's called age-related macular degeneration. And, there is a number that, they show the number, I think the number is very big, even for Brazil, the amount of people that have this disease. And of course, principle of PDT. If I can destroy that region, I can solve the problem, why not use it? And I think the use of PDT for macular degeneration is today already commercially available as a first choice for this type of disease. And this is an example, maybe, for us involved with cancer, the way we should proceed, but maybe we're not doing that. That's why still this is not PDT for the cancer, it's not the first choice. Of course, there is another advantage in macular degeneration. You have no choice. So it comes like a miracle. Oh, this is the technique that's helping, which is not the case for cancer. For cancer, we still have a bunch of other possibilities that are traditionally engraved in the present medicine practice. But this is a non-cancer application with a lot of success. And if for some reason you come during your life to have macular degeneration, I'm sure they're going to solve the problem or try with photodynamic therapy. And the idea is simple. It's the same idea. You have to destroy what's not good. And normally, what is different in a tissue has this affinity for molecules, more than normal tissues. And you always using this as a possibility for photodynamic therapy. So the macular degeneration is an anomaly that happens in the back of the eye. And when you have this, you don't see the image clear like this. You see the image like, see a part of the image is blocked from this because of that part there. And the idea here is you just use a photosensitize, and then you go with light, and you destroy that part, and you recover the normal situation with the vessels and everything. So those are the numbers that they estimate. So it's, people that need this is about 200,000 in Europe, 200,000 in North America. And they say the rest of the world is 100, but we know it's much, much more than that. That's what they are doing at the present, I'm sorry. This is the numbers they are treating. We don't have 200,000 PDTs for cancer treatment in North America, not even adding up all the patients that were treated up to now. But for macular degeneration, they already have it. And the procedure is very simple. They use, Visudyne. Somebody said something about those composite, and I think Cacilda asked about. And, they have all the structure of the sensitizer we use, and you just come with the light in there. You use infrared lasers, and this is the degeneration, before and after the PDT, and they recover the back of the eyes completely. And those are pictures on diagnosis of this. So this is an example of non-photodynamic therapy that is still not in the best situation. They are still proposing ways of doing that much better, much easier, okay? But it's already a big success, right? Now, another case is the actinic keratosis. And this is also a non-malignant kind of lesion. It may become a lesion in some situations, but this is so advanced, and I stole this transparency from Brian Wilson. And they are already doing a kind of light stick. You know, sometimes you produce a chemical reaction, and we're using that in parties and everything, and that emits light. So there is a company already doing a light stick that, you know, is a colevolan. This is the light stick, and you just go and put the drug in there and illuminate. So you break, and you have light for a single application. It's the same principle of PDT, and it seems to be working well. And, well, anyway, that's what's going on. Oh, this is some of those treatments involving this. Huh? But I think this is where PDT is going to make a big difference, is antimicrobial photodynamic action. Because the same way you can kill cells, you can kill all kinds of microorganisms. And the principle, again, is the same. Of course, there are some challenges here. How you make the drug to penetrate in the membrane of those microorganisms and everything. But, you know, a lot of physicists and biochemists and everything trying to solve this problem. And once you can solve that problem, which people, we are getting by grant, I mean, everything is happening by itself. All the photosensitizer we're using, most of them are already used for microbiological control and using as a bacteria killer. And of course, one of the reasons for this is that we all know that some of the bacteria are getting resistant to antibiotics and other types of chemical. And that's a big problem that people are facing. And I hear not long ago that Staphylococcus, how you say that in English? Staphylococcus aureus. Staphylococcus aureus. They are already resistant to normal medications. And as you know, that's one of the most important cause of infections. And nothing can resist to reactive radicals, oxygen or others. You know, there is no way that bacteria will suddenly develop a resistance to that. So that's a good killer for them. And of course, there are other reasons, and this is so bad done here that I apologize. So that's an example for this kind of microorganism. Before PDT, it's an integral microorganism, and after PDT, this is, you know, complete damage and destroyed, and so it's very efficient. So if you see here in this field of image, almost all the microorganisms were affected by a simple procedure of PDT. And of course, people are studying how can we kill those bacteria, and we have to, those microorganisms doesn't work only for bacteria. And then we have to do all those studies again. I mean, what's the amount of light we're going to give? And what is the actually surviving factor or fraction for those microorganisms? So this is a study that was taken from somewhere that shows here one type of chlorine being used to kill a specific type of microorganism. I'm going to show some of the ones we are doing later on. There is another case of infection together with inflammation that's in the dentistry procedure, that's a periodontical disease. And here, normally, you have bacteria accumulating here. And by using different types of photosensitizer, you can reduce quite a lot the amount of infection in those locations. And of course, if you have, I never had this disease, but people keep telling me that's a very brutal procedure to go and remove by force the infection and everything in this region here. That's called the periodontical bag. Is that right? Pocket. Periodontical pocket. So this is another application that's coming, and the number of people suffering from periodontic diseases is quite large. And this, may be so simple that you come and inject some substance, wait a little bit, and illuminate. You don't have to come inside to illuminate. You can illuminate by outside. And in fact, there is a student from our group that now is in the United States that even developed a small film, polymeric film, that has the photosensitizer on it. And then you come and introduce this little film on the periodontical region and wait, and this film dissolves the infection that are there, absorb this photosensitizer, and then you just illuminate from outside. So this is another application that are very important and are growing. So this is the way that this is done. And recently we have done an experiment with the Staphylococcus aureus. And so those are colonies of those. And then if you just introduce the photosensitizer itself, if you're using so large amount, it kills already some of the bacteria. But with light, it's an amazing destruction of the bacteria. And if you look at the graph, this is an advertisement. For doing those studies with bacteria, we have developed what we call a biotable. Maybe it should be a biophoto table, but it became too large name. And this is a table that you can work with those plates that they do bacteria or microorganism cultures. And you can guarantee uniform illumination and do those studies and vary intensity and doses and everything. And those are the results. You see, we're using Photogen, but it's not necessary to use Photogen. Some people like to use the TBO, which is a blue dye. And of course, for some of the infections, it works fine. But for teeth, you don't want to put blue stuff in there because the teeth became blue. So you kill the infection and the guy gets a very nice blue teeth. That's not good. So you want to find the right dye for the right application. And this is, what I want to point out, that this is the work with the Staphylococcus. And this is the control here. So we have done nothing in this guy here. Only put light. Light doesn't do anything. But then, when we start to add light, first we start to add a very little amount of photosensitizer. For zero light, you already have some decrease in the amount of bacteria. But when you add light, and this is not so large doses, you can almost, people are claiming that maybe you can do with low intensity lasers, PDT for caries and other types of infection. That's not true, because for those lasers, you can't work higher than this normally in a decent period. So don't try to do this with this laser. Not going to work so well. But if you start to have a middle size of intensity that in a compatible time, few minutes of application, you get those types of doses, you are decreasing. If you're coming from here to here, means 10 orders of magnitude in the amount of bacteria. So it's like killing 10 billion times the amount of bacteria you have. we can call this level here almost sterilization. But in most part of those applications, you don't need to sterilize completely. That means you don't have to kill completely the amount of bacteria. You just need to decrease to a level that the body can deal with. So there is no, I don't see any, and now a lot of papers are coming in the literature showing the microbiological effects. And I think this will become, because infection is a big problem, you know. And of course, this is another result with a collection of bacteria for carry, induced carries. And we think we start to understand even how is the dynamics, how is the D here is the dose of light, and C is the concentration of drug. And we start to see how they are connected. Why we need to know that? Because we have to create some diagrams like this, where if you put some concentration, you know what's the light dose you want to give to guarantee decent killing of those bacteria. And killing means if you want to kill above 99% of the bacteria you have to work above this line. If you want to kill 95, above this, and so on. So this is what I call the universe of concentration doses to really deal with the bacteria killing. Okay, and of course, we're going to have to understand this type of things to predict. Okay. Oh, that's the, this is another thing here. People that use dental prostheses, they have one problem, and the number of people that develop infection is quite big. And they discover that the problem is in the prosthesis. Okay, it's not the amount of candida. What is the name of this thing? Candida. The amount of candida in those prostheses produce a big infection. And then they have to find a way of killing the candida of the prosthesis itself. You can't use chemicals because chemicals get inside the prosthesis and then produce a reaction to the mucosas. One way of doing is you just give a bath of the prosthesis. This is a dentadura. It's a dental prosthesis. And if you give a bath, and then this photosensitizer even penetrate in the pores of this plastic in here, or this material, and then you do an illumination in a small camera for 15, 20 minutes. And this is a work that starts to go on in the dentistry school in Araraquara from UNESP. And then you can kill the bacteria because they are doing this with, they already know they can, this is what solves the problem, is killing the bacteria in the process. But they can't do chemically because they are seeing reaction on the patient because of the leftover of the chemical substances on the process itself. And then there are many other applications. Now, if we have patients with stomatite, and you know, this is a problem that always have infection together, and you can do a superficial PDT for those cases and solve the problem, especially patients that are deficient in the immune system. So you can use PDT for disinfect and having a good, and mucosite is another case, and that's very related to patients under treatment for cancer. So they develop this inflammatory and infected problem on the mucosas, on the oral mucosas and other mucosas. And of course, you can treat with PDT, and this is a work that now is going on in the Hospital Albert Einstein in São Paulo. And we're going to be able to show the results. And for doing this treatment, you need special devices. You know, you cannot carry a $50,000 laser around. So you need to use the devices that are not so expensive and reliable, and those are the LED devices, and we have been prepared special devices for illumination of the oral cavity, and also for going down on the pharynx, the pharynx. And this looks like, you know, a spoon like this that you go deep in, and you can do the treatment in there. And then you have other applications that we have been doing, and this is the papillomavirus. And again, the lesion likes very much the photosensitizer, so you can more or less have selectivity like you have for cancer and do the treatment. And this is being, at least in some of the patients we have done, is going very well. And you can have other applications like psoriasis. You know, it's another type, and the number of people that has that. Some people are treating this with UV light, and of course they have some success. But with PDT, it's faster, and we can use some of the ALA kind of substance that induce porphyrin formation there for the photodynamic therapy. And this was extracted from this kind of publication. And as you can see, it's very recent kind of publication, because now people are taking the use of PDT for other diseases much more serious, I think. And well, this is the same type. And of course, comes the part of cosmetics. You know, everybody wants to be beautiful. Doesn't matter if you're rich or not, you want to be beautiful. And some people like to make a peeling, because the whole idea is you destroy a layer of cells, and then hoping that the recovery doesn't remember the defects and gets better. And people are already doing peeling, face peeling, with photodynamic therapy. You have a ALA, you pass a little layer of ALA, wait some time, and then illuminate. And of course, the illumination here, you want to produce a very superficial necrosis. You just want to kill the superficial cells. And I think for that, the blue light is the best one, because you want to avoid big penetration. And the results are quite good. It's so good that people are using now in the United States very often this application, and you can have very good results and sometimes fast. And this is a fancy word for just what I told you. Make a peeling, a photodynamic peeling now, and waiting the recovery, and most part of the time recover better than was before. And so you can get good results of this. And you see, the doses that you normally use for those applications are not high. So again, we can produce very simple devices that hit those doses. I know that there is an American system that's called Soft Light that costs $30,000, which I think is too much. But anyway, with a few thousand reais, you can make devices for doing this job, and I think this will be within the Brazilian reality. This is a prototype. We built it in São Carlos, and we are now finding partners to make the first tests. This has 32 LEDs, blue, each one emitting about 0.5 watts of light. And with this, you can make a good peeling on the face or in the army, or in the breast, or anywhere else you want. And of course, sooner you're going to start to have anatomic devices for make it here, whatever you want. Because the